With us right now is Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital. Joe, rib injuries. We see it a lot in football. High-profile players get them. Do you get a lot of this?
Yeah, we do, and they're difficult to manage. I don't really relish them. I don't love it when we see them because they're a little tough to manage. And what made me think of it, this week, last night they had the BCS rankings. I don't know if this is ideal for sports fans. Doesn't it seem like Alabama and Clemson have like two nailed-down spots every year, and maybe Ohio State? But this year, kind of crashing the party, a surprise team. My alma mater, actually, I went to Notre Dame. Notre Dame's in there. And part of it's because this incredibly great quarterback stepped up. People comparing him to Joe Montana. He's been wonderful. But midweek last week, everybody was surprised he's not playing because of a rib injury, and he's questionable even this week as to whether he'll play. And that's the way it is with the sports medicine team. It's a little hard, Ray, to decide when people are able to play. The rib cage, kind of acts all as one. And even though it has cartilage and bones, the ribs, and muscles, the intercostal muscles, it acts as one, and it is the most elastic area in the body. So that it expands and contracts every time we breathe. When we're playing a sport and we're breathing harder, it contracts and expands. And when there's something hurt or broken or damaged in that, it hurts to run, it hurts to play sports. People just can't do it because these are very painful injuries. We even occasionally try to use injections, but when the whole rib cage is involved, it's still very a painful injury, and it's very hard to get a read on whether somebody's going to be able to play or not. And occasionally we get MRIs, not all the time. We'll often start with an X-ray to see if there's an obvious fracture of the bony part, the rib, but MRI really tells us a lot more. But because many of these kids are better within 10 to 14 days, 2 or 3 weeks, we don't always go to that fancy expensive test, and we just kind of treat kids for a while and wear a rib belt to splint them and give them support as the rib cage expands and contracts. But it's a tough injury to deal with, and so yes, we do see them quite a bit, and especially this time of year as our high school teams march down to the Final Four. Yeah, we see them a lot in the sport of football with the fact that it's such a collision sport.
Joe, sometimes we hear rib injury and we say, oh, they can play with that. But really, when you try to get out on the football field and you have that rib injury, taking breaths and moving, it makes it really difficult.
It does. And so what people do, they splint themselves. They're kind of trying to protect that area. And so like in baseball, we say pitchers don't pitch the same. Quarterbacks just don't throw very well. They don't run well. Their mechanics become affected, and then they get another injury, or they're more prone to, other things happening to them. So we have to make split-second decisions. And, on the sidelines, it's a really tough call in the middle of a game. Or in this case, last weekend he looked pretty good, and by midweek this player was, not able to practice very well because of the rib injury, and so they had to pull him out of the game. So it's not always the easiest thing to tell about. It affects other things, and it's kind of a unique area because of the fact that there is cartilage, muscle, rib, bony part. All of that is affected when ththese kids have significant injuries to the ribs.
Worst and best case scenario on recovery from that, Joe?
It all depends on the spectrum of how badly it's injured. And so when it's a broken rib, it's going to take more in the range of 3 to 6 weeks before they're going to be ready. When it is one of the other structures, it's very variable. I mentioned to you 10 to 14 to 21 days, depending on the severity of the injury to the muscle, to the joint. The joint is where the cartilage and the rib meets. It's called the costochondral joint, and a lot of kids, that's right exactly where they have the most of their pain. That's where it might be amenable to a shot sometimes. So you hear of people, hey, geez, where would you do a pain injection on somebody with a rib injury? If they have injury in that joint, it's kind of local, and a lot of times that can reduce the pain, reduce the splinting, and allow people enough time to play. But there's a lot of clinical evaluation that goes into it from our standpoint to make decisions of when kids can play and not.
All right, Joe, good information and education for us, my friend. Appreciate you coming on with us, and we'll catch up with you next Wednesday.
Okay, Ray, have a great week.
You too, my friend. Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital.